specialities of medicine.
Silent, please. Don't talk inside the room, please. Go out if you want to talk.
Good. Thank you so much. So, we all know the healthcare specialities that we come from. We have psychiatrists, we have pulmonologists, we have allergists, we have all kinds of specialities. All specialities, we need to think this way. So this is an old paradigm, and what is the new paradigm is what we're going to discuss in further. So how are we different, and what is the paradigm that needs to be shifted? So we never ask how or is everything connected. So that's where we are missing from the old paradigm, and that's where we need this change. That we need to ask, is everything connected? We are trained to practice match the pill to the ill. That's what we train as. But what if we ask questions, are the diseases connected everywhere, so that we don't just practice matching the pill to the ill? So we are asking the wrong questions. So that's why we are here all together to understand, we are trained very well, but the disease are not improving, or we are not able to cure as much as we expected. So are we asking the wrong question? Is that what we need to ask? Next please. So what are the right questions to ask? So one of the Nobel Prize winners said, discovery consists of seeing what everybody has seen, but thinking what nobody has thought. So this is what we need to think. So we need to think different. It's not about discovery or invention all the time, but the things are seeing everything different is always comes to a diagnosis differently, which was already discovered. So are there any viable alternatives to medication? Is there any different way to think? Is what we need to think differently. Next please. So the new paradigm is believing that the body is interconnected, whole, and does not separate the brain from the rest of the body. So puts the power for change and health back into the hands of the patient and family together. It's the patient we have to spend some time with history taking and the family together, value the entire person, the body, mind and soul, and to their entire life context. If we dedicate some time and do the entire life context together, I think we can better think of cure than managing the diseases. Next please. So this is the new paradigm which we know that we need to come to the root cause. The root cause does exist and can be identified and effectively treated, often using, as we talked about, diet, nutrients and another non-pharmacological means. So before going to the pharmacological means, can we do the non-pharmaceutical means? Believe that illness is multi-causal and therefore health is multifactorial. So believe that the body and brain to work optimally, it must be fed optimally. So if we have that shift in our mindset, and if we have the shift in the change of thought process, this is the thought process that we need as healthcare professionals and healthcare providers. We need to have that shift in the mindset. If we can have the shift in the mindset, then we can change the shift in the patient's mindset as well. Next, please. So how are we different? How can I be different? It's the patient's story. So the story has many answers. When we were in medical school, the history taking was so important. We never had that much luxuries of CT scans, MRI, and PET scans, working in government hospitals. We always, the history taking was mostly emphasized. But that still goes back to the same story as the patient's story and the clinician's thinking, a place to start. Whatever the traditions or training, the healer, the healthcare practitioner, patient together construct a story of the problem. The most comprehensive method, integrative experiences, perceptions, observations, objective information into a coherent, culturally sensitive narrative. Because we all depend on different cultures, different modalities, we come up with different backgrounds. So it's not the disease that we have to speak, we have to address the culture at the same time. Next please. So the patient story, whatever the modern or ancient or Western or Eastern disciplines, physician or shaman way, we have been taking in the system as a factor. So that is the Tibetan healers which we had before. To patient questionnaire accompanied by physical exam to the laboratory data is the Western medical model. So we have different kinds of model during this Stone Age medicine. So this is what integrative medicine is. So integration, functional medicine and precision medicine, we all need to come into together as the olden practice of medicine to the modern medicine. Next please. So putting all together, I call it as functional medicine as the matrix. So if you talk about the matrix has different components to it. In standard medical care, efficiency is gained by generating, sorting and information through a well-established and very useful model. So chief complaint, medical history, presenting the problem, past medical history, social work history, drug sensitivity and complete review of systems. So the standard medical is organized to achieve a quick and highly useful discussion of the patient story and short list of potential diagnosis. So the process of selecting the common leasings of potential diagnosis, achieving the differential diagnosis, usually facilitated by collecting further data, physical examination, laboratory measures related to the most clinical choices. So any methodology of constructing the coherent story, an effective therapeutic plan in the context that we need to bring it together. Next please. So what does the matrix consist of? The matrix has an acute setting. The clinical information requires contract to a very slim. So here we have to understand the difference between acute management and a chronic management. So in the acute, we don't have that much time to collect data, to collect information. So it's okay to, find the modern medicine for acute care. But in complex chronic care, a multiple or comorbidities are occurring while we need to take some time, large database and relevant information. So in acute information, it's okay to call it the emergency medicine, but in chronic diseases, the complex chronic diseases, the review of systems, review of mechanics must engage the clinician's attention. So functional medicine matrix is this process includes the mind, body, psychosocial needs, mechanisms, as well as physical. So next please. So functional medicine is the whole person from disease care to health care. So is personalized, system-oriented, model that empowers patient as well as practitioner to achieve the highest expression of health by working in collaboration to address the underlying cause of the disease. Next please. So education and empowering is also equally important in the patient care. So if we don't have an education and empowering the patient, we will be missing the diagnosis as well as curing the patient. So education is the key, educating the clients leading to partnership between the client and provider, creating healing community, support system, optimal healing does not occur in vacuum, stress management practices, restoring a sense of meaning and purpose of their life, promoting sleep, relaxation, play in restoring a strong sense of self-efficiency, supporting sense of spirituality and spiritual practices can also be part of the integrative medicine. That way we are respecting their culture, we are respecting their beliefs. If we don't respect their beliefs, then the disease might be half as bad. So that's where the integrative medicine is all together as whole. Next please. So one condition, many imbalances. Yes, next. So one imbalances, many conditions. So you have to come to this kind of shift. When we are talking about obesity, so person can come from obesity, but again, it's hormones, inflammation, genetics, epigenetics, diet, exercise, and mood disorders. So when we are talking about inflammation again it has more end organ problems, which is diabetes, cancer, arthritis, mental illness, and heart disease. So when they come for the inflammation as an end organ damage, and as well as they come with obesity, but we have to have this reverse thought process. Next please. So root causes of the disease are complex and multifaceted, many causes, many influences, and many solutions. So we need to take our own time. We need to take our own history taking, causing multiple causation, multiple influences, and as well as because we are here talking about multiple solutions. Next please. So this is what the functional medicine is all about. So the triggering events, which is an activation, patient, predisposing factors, again, nutrition status. This is our questionnaire in our clinic about the, we have 4 to 5 questionnaire about their nutritional status, their exercise, their belief system and self-care and relationship and sleep. So this is in our history taking in the questionnaire when they give us information already while they are filling up the data for us so that we can address before they come and see the physician. This is already in the data about their daily living status. So compared to their demographics, you have to take care of their sleep pattern, their work pattern, outdoor working pattern, indoor working pattern. So everybody has a different diet. If the person is coming and an outdoor working person, but the diet is going to be different. I'm an indoor and an IT person who's going to come and sit in a computer for 12 to 15 hours a day. The diet and the metabolism is going to be different. So it's so personalized according to their lifestyle. So the precision medicine and functional medicine is going to be the future of medicine because everything is changing and we are into the AI future. So we have to change as the things are changing around us. So this is the oxidative. So when they come up with this story, then we make that conclusion and when we make building the blocks or connecting the dots. Detoxification, biotransformation, what are the hormones or neurotransmitters regulation, psychological and spiritual equilibrium, and structure and membrane integrity, digestion and absorption, and immune system and inflammatory process. So the history taking as much as in detail is quite important. Next please. So again, going back to as we've been talking here, this is a summary of everything together. We are talking about the environmental inputs, the diet, nutrition, exercise, energy production, which is oxidative stress, detox and biotransformation, what is the patient's toxic load, alcohol consumption, anxiolytics, drug-to-drug interaction, hormones and neurotransmitter imbalances, mind and spirit, structural imbalances, poor proposition, any joint, pain, ankles, prior similar injuries, deconditioning, neurological issues, GI imbalances. In the GI imbalances, proton pump inhibitors, are they doing any high fiber supplements, calcium, magnesium absorption, and vitamin D sufficiency. So all this is what is very, very important because it's not about supplementations, it's about absorption. So I have now been practicing like this for more than 15 years. Everybody is taking so many supplementations. From polypharmacy, now it's called polyvitaminosis. I should say that. But that's where our physicians will come into the patients is about absorption. We have to pay attention to their absorption, their GI, with the proton pump inhibitor, their acidity status, proton pump inhibitors, their acid, production and absorption. That's why the leaky gut, everything comes in place. It doesn't mean necessarily if we are taking so many supplementations that they're going to get absorbed. So this is where we are, getting a wrong name at the same time because it's supplementations. But when we talk about, as yesterday, we talk about citric acid cycle, where the cofactors are necessary, where everything is necessary, and we are doing the precision medicine by testing the organic acid testing, and when we are doing the right thing, then nobody is going to question us. We are going to be respected as evidence-based messages as it can be. So that's where we are here to learn that how can we be more into with genetic testing, if SNPs and all that understanding, how can we be more towards genetic testing, towards evidence-based practice of medicine in the precision medicine and functional medicine. Next please. So what is it? So it is gene, environmental and lifestyle. So they all go hand in hand. Whereas before we talked about genetics, now it's the era of epigenetics. So what is epigenetics? You already heard about it, but it's the environmental and lifestyle and individual choices which come along, which is triggering or stimulating or suppressing the genes. So genetics loads the gun and lifestyle pulls the trigger. So we have enough information here, we have enough data to talk about how the genes are controlled and how the genes are expressed. Okay, so that's what, even though I'm genetically positive, but I don't mind me expressing that gene. So this is where the functional medicine and Christian medicine is different. So heavy metals, biotoxins, toxic mold, set bleeding syndrome, Lyme diseases, candidiasis, and environmental toxins, pesticides, parabens, food additives, and glyphosate. So these are all the pesticides which are being going for the food that we need to be familiar with, testing our food for these kind of toxins as well. So toxin burden is the cumulative impact of all the above. So the lifestyle, environment, and genes go in hand in hand. Next please. So this is what we are looking at, unfortunately, how to work up the toxic patient. This is what we are exposed to. We know all these, but we are not avoiding all these, but we cannot. We need to work with these synergetically. Next please. So basic pillars of the processes is reduce inflammation and oxidation, improve nutritional level, which because they play a major role in detoxification as cofactors, as in the biochemical, citric acid cycles and all the other biochemical pathways. Minimize toxicity, minimize stress, improve diet and lifestyle. If we can manage and diagnosis on these 5 wings, we will come to the diagnosis and we will be able to help our patients better and ourselves too. Next please. So symptoms of heavy metal toxicity can be anything. Can be any kind of system or organ. So we need to know that mood swings can be because of the aluminium and lead and manganese and mercury toxicity. We can have hallucinations with aluminium and arsenic toxicity. We can have mania with lead and mercury and tin toxicity. We can have irritability with aluminium, anxiety, depression. So toxins can cause our metabolic, we can have symptomatic management. So psychologically, if something is imbalanced as well, we need to think toxins as the main way. Next please. So again, suicidal ideation, developmental delay, insomnia, homicide and confusion, aluminium, lead, thallium and tin can cause confusion and developmental delay. Because children come with developmental delay, they are not as growing as much as expected. Parents are tall enough, we did the bone testing, we did the x-ray, but the children are not growing anymore. So we need to check their lead levels and thallium and tin levels, which we can do arsenic levels as expressed with the previous speakers. Next please. So vitamin B deficiencies can also have symptoms. So fatigue, anxiety, brain, nervous system changes, mental sluggishness, again sleep disturbances, mental confusion can have these kind of deficiencies. So when the patient comes with symptoms, yes, we need to put things as a vitamin deficiency as a symptom. So folic acid deficiency, as we all know, B12 and folic acid has to be at the right molecular level and at the right methylated level, and the B12 cannot be produced as an intrinsic factor if they're having acidity or GI distress. So that's why whenever we give the absorption with methacobalamine and cyanocobalamin and L-methylfolate can be different. Even though the patients can bring their supplementations what they are getting. So the problem is they are taking the wrong supplements, which is not getting the absorption as well. Next please. So the same thing as vitamin C, D, E, as we all discussed, choline, inositol and biotin can have deficiency, can have mental disorders to adrenal fatigue. These are the vitamin deficiencies and symptom related. Next please. Again, no calcium deficiency, again irritability cases. Usually I don't prescribe calcium as a supplementation because we have enough calcium with the diet part. So you need to look if they are already having enough calcium in our food, because patients usually we do have enough calcium in our food. So it's all about culture again. Are they taking enough calcium in their diet? So that again calcium alone is not going to get absorbed properly, but it needs cofactors and co-supplementations at the same time if they are taking calcium. So you need to know the absorption between one supplement and another supplement at the same time. So if you're doing wrong combinations, can produce, can store, these supplementations also can store as stones, and people talk about kidney stones or gallbladder stones? Yes, we've been seeing different kinds of stones as well, because they have calcium oxalate stones and everything. So we need to pay attention to all these things. Magnesium, again, it's very, very normal, very, very important element that we can talk about more. Poor memory, insomnia, weakness, tremors, fatigue, and all can cause simple magnesium deficiency. Next, please. So methylation and pathway of stimulants. So this is what we discussed already about the common stimulus, MTHR, VDR. So knowing the MTHR status is not enough, as doctor has already, the speakers, he's already mentioned very beautifully about methylation. That's everything in the body. There is a complex pathway designed to produce right number of methyl groups managed by a series of genes. So we can be over or under methylated or both. So depending on the combination of the genetic snippets occurring, because leading to serious, major and minor chronic causes because of the chronic diseases. Next, please. Happy hormones, again, thyroid, adrenal, reproductive. So as functional medicine, we need to all, integrative medicine, we need to be familiar as general practitioners. If you can be aware of these three organs, then we can do much, much better, and then we can still refer to the specialist of the same functional medicine or integrative medicine specialist, because they definitely do a better care of the integrative medicine. But we, as GPs, I'm a general practitioner, I'm a GP, so I make sure that thyroid, adrenal gland, reproductive can be practiced in any kind of general practice. So, but at the same time, again, if you need more help, yes, we can refer to the integrative medicine specialist. So thyroid is very, we can treat thyroid if we know. So I'm going to let you bit more elaborate how functional medicine has taught us in a different way of thyroid, of animal reproductive, as doctor has already explained very well about the estrogen and the estrone and E1 and E2. So that's a beautiful way of looking at the reproductive way of PMS and postpartum depression and menopause. So menopause symptoms can be tested with the E2 and estrogen and estradiol testing can be done with the progesterone levels and the DHEA levels, and we can make a difference to our patient, and we can avoid, maybe we can prevent estrogen-prone breast cancers and uterine cancers. Next, please. So basic labs. So the basic labs that a simple, a general practitioners need to depend upon. Okay, I don't have a facility where I can do organic acid testing, or I don't have a facility to do genetic testing, or anything like that. It's okay. Just start with the basics. Start with the basic testing which is available in your diagnostics. Start with basics, and we have lots of information in the basic tests. So just make sure that we are not doing the total T3 and T3. Make sure you do T3, free and free T4, and ultra-sensitive TSH. Talk to your lab diagnostics to get the right diagnostic test. So everybody, I see many people, talking about still ordering total T3 endocrinologist, and still depending on total T3 and total T4. But no, yes, free T3, free T4 can give you enough answers of the conversion of T4 to T3 and the antibodies. Make sure that antibodies are tested to every abnormal TSH. Every abnormal TSH, don't just diagnose them as hypothyroidism. Do more testing. Repeat the test in 3 to 4 weeks or 6 weeks. It takes time for the TSH to get corrected. So repeat the test. Sometimes they're having an infected phase. Your TSH can also be abnormal with simple fever or simple acute infection or acute stress. Your TSH can still be abnormal. So please repeat the TSH in 6 to 8 weeks and still see T3, T4 before you put them on, levothyroxine or thyroid medications. There's so much to know on the GGT level in your liver function test. There is so much to talk about, the lipid peroxidation, as yesterday we discussed, an iron panel, ferritin, and homocysteine, and adrenal profile and hormonal profile. So you can diagnose many things only with the basic lab test. Then going into the cholesterol, talk to your labs about lipid peroxidase testing with more LDL testing. Again, if it's not available, there is a formula. You can convert yourself to the clinic and then you can treat many conditions. Next, please. So the basic principles of detoxification is optimization, support. So you need that support of mitochondrial function, elimination, excretion, hydrating, sweating, and bowel function. So when you're optimizing, you have to make sure that that triggering factor is eliminated, excreted, hydrated very well, and sweating or bowel function. Then again optimizing the liver by biotransformation. So that's where the mitochondrial function. Next, please. So this is explained by the previous speaker. If you don't understand the phase 1 and phase 2, what happens in phase 1 and phase 2, we will not be understanding the detoxification method. So the phase 1 is cytokine P450 enzymes, and phase 2 is sulfation and glutathione conjugation. Everybody, again, if the phase 1 is not corrected, how much of the glutathione we are going to give them? The glutathione conjugation is phase 2. So we need to understand oxidation, reduction, hydrolysis and hydration before we go to the conjugation pathways. So that nutrients is needed with phase 1, and then with phase 2, they both are different. So in the phase 1, we can start with the initial consultation of talking about their nutrient levels, what do they need, again B2, B3, B6. Then you can go to phase 2 while you are working on the waste and disposal. So nutrient needed in the phase 2 will be more specific. You can go for IV glutathione, vitamin C's, and folic acid, choline, methionine, and your taurine and magnesiums as well. So we need to have a clarity between the toxins, which is phase 1, and waste, what's soluble waste is phase 2. Next, please. So supporting the liver detox in phase 2. Next, please. So support gut and phase 3. So support detox, the phase 3 is the gut. So the phase 1 and phase 2 happens in the liver, and the phase 3 happens in the gut. So elimination diet, and there is something called 5-hour program in the gut. Again, many people are doing coffee enemas, colon hydrotherapy, probiotics, stool bulking agents, fiber, soluble fiber, insoluble fiber. So many people say, I am on a very high fiber diet, which did not help me in my practice. Because we need to understand what is a soluble fiber and what is an insoluble fiber. Many patients don't know what is a soluble fiber and insoluble fiber. All fiber is not supposedly a non-good fiber. So you need to know what is soluble and insoluble fiber. So cellulose, okay, beets, all these are insoluble fiber. So you need to know how to take them. You need to know how to ingest them when you're taking, because it's an insoluble fiber which can get accumulated and still cause constipation, even though they are on the green detox diet and the green diet and the raw diet. We still have problems because they might be taking too much of insoluble fiber. So rice bran fiber, chlorophyll, and polyphenols, that's what people come with all these kind of already doing with so much of information on the internet. They've already done this. So we need to know what is their detoxification pathway. Next, please. So the lymphatic support. So when you're doing detoxification, the GI in the gut and the liver and the lymphatic support. If you don't have enough lymphatic support, then everything is going to be blocked. So regular and gentle exercises, castor packs, as many people have been doing them, and then it's not, that's a very good way, and there is a scientific data behind that. Hydrotherapy, lymphatic drainage remedies, lymphatic massage, dry brushing, rebounding. So you need to know what is the method, and you need to explain why you're doing what you're doing. So if you don't explain the patients that why you're doing what we're doing, they don't develop confidence in us, they don't develop trust in us, and they keep doing doctor shopping, and they keep continuing to change the doctors and again. But if you explain, I'm trying to do your lymphatic drainage and I'm trying to support your lymphatic support, they do develop trust, and they will still go and Google about lymphatic drainage, which is good, but you're giving them the right direction to have the right research and to have the right information. So you do things and tell them why you're doing what you're doing. Next, please. So again, if it's one organ that we need familiar with, is the thyroid. So how only, because of the time frame, so I just took this thyroid as what we learned in functional medicine. imbalances, and that's why there were a lot of studies in the early 1900s regarding thyroid and thyroid metabolism. So thyroid can be autoimmune, chronic lymphocytic thyroiditis, Hashimoto's thyroiditis, granulomatous, and fibrosis. Everything is different. Not everything can have a diagnosis similarly. So we can have an infective thyroiditis at the same time. Next, please. So, where did we start all these? All the way going back to 1912. So that's where we started seeing Dr. Hashimoto's and something called Hashimoto's thyroiditis. He is a pathologist. Dr. Hashimoto's reported histological changes in 4 thyroid glands, causing numerous lymphoid follicles, extensive connective tissue, diffuse round cell infiltration, and significant changes in the SNR epithelium and struma lymphomatosa. So that's where we started as asking about thyroid. But again, at that time, it was not observed in the US. Again, next please. Again, autoimmune thyroid disorders. So before iodized salt, I'm sure many of your patients or us, we ourselves are using iodized salt for quite some time. So, but for me, just by observation and clinical studies and looking into making me think, did we change anything by introducing iodized salt? That is the first question I asked myself 15 years ago when I said, what am I missing? Am I missing something? Because everybody, I was practicing in US and everybody is using iodized salt. So when everybody is using iodized salt, but we had more cases of hypothyroidism. So when more cases of hypothyroidism, nobody had goiters. The goiters disappeared, but there was hypothyroidism more and more. This is the question made me ask and dig into the missing puzzle. So the missing puzzle, what is this? Why are we having hypothyroid when we thought the iodized salt kind of cure thyroid? So that's where functional medicine gave me clarity. That's where I said, okay, we're missing many more puzzles and we need to look into it. So before iodized salt, Dr. Hashimoto's findings were not seen in the US during direct slides taken at that time from thyroidectomies before iodized salt. So this is that findings we had, it was even before it was introduced by iodized salt. And when they found was no lymphocytes in the thyroid gland, it should be emphasized that thyroid glands prior to the use of iodized salt were devoid of lymphocytes and nodular goiters were there. After the introduction of iodized salt, there was still dense lymphocytic infiltration where continued to find. This is the pathological finding which are different. Next please. So that there was another study in Mayo Clinic, they looked into 3 different time periods. So it was also after iodized salt which came out in 27-28, again found further, so you moved into there more Hashimoto's there. So could salt be the cause for the today's lymphocytic change? It's a question to be asked. Again, could it be iodine that's in the salt? Or is it a reasonable question when you look at it, what kind of iodine we need? We need iodine. But what kind of iodine, maybe it's getting absorbed or not. So this is all a question to be, puzzled as and still remains as a puzzle because we need long-term studies, but we have enough answers now. Next please. So by the NHS again showed that iodine levels have fallen more, 50% in the last 40 years. So it can't be iodine, which was replacing by the iodine salt. So it could be the salt by itself. So this is the question. Is it the salt alone? Is it the iodine salt? Or what kind of iodine we introduce in the iodine salt? Could it be the goitrogens, such as bromine, chlorine, and fluoride? So this is where we are talking about toxins, right? So what are the specific toxins for thyroid? So is it something called goitrogens came into limelight, called bromine, chlorine, and fluoride? Or it is a combination of iodine salt and goitrogens, which is exactly what you think is happening, why the Hashimoto's came after the iodized salt. Because all goitrogens people were exposed to in the form of these 3 things. So goitrogens, again, iodized salt or both combined together. So we need to tell that our patients to avoid goitrogens if they are taking that. Next please. So remember, iodine levels have fallen 50% in the last 40 years. So it can't be iodine causing autoimmune thyroiditis. So what does the Hashimoto's cause? It's not the iodine, it's probably so played exactly, especially the goitrogens. But what they don't comment on, it's impossible to experiment induced Hashimoto's disease in the lab by administering iodine alone. So antithyroid drugs or goitrogens can induce Hashimoto's disease in the lab when there is a little bit of iodine as well. So goitrogens induce not only hypoplasia, they cause iodine deficiency also. So this is the conclusion that it in itself can cause iodine deficiency by blocking the receptors for iodine. Next please.
Excuse me, Doctor.
So
we have 5 minutes.
So this is the thyroid in depth. Again, organification, oxidation, H2O2, what is the TPO levels, about organification, lipids will occur, iodine intake in excess of RDA. This is the thyroid pathway that we need to think where everything is getting blocked and what is, organifications in T3, T4. Next please. In detail, again, TSH, oxidation, H2O2, TPO antibodies, again the RDA levels, again the abnormal RDA levels, the thyroid antibodies, however, with iodine intake in excess of the RDA. Next please. Again, the TPO antibodies, the cycle where NADP oxidase system is getting calcium and iodinated lipids, again, which is the inhibition of that hormone called anti-TPO and anti-TG. Again, treatment can be magnesium, B3, selenium. So, conversion of T4 to T3, yes, we use a lot of selenium, again, magnesium, because B2, B3, because again, this is the pathway that we need to look into. Why we need supplementations only, other than only thyroid medicine, as well as supplementation because of the conversion and because of the TPO and TG antibodies. And you can do testing. You can do before testing, and you can give 1 year time, and you can do the TPO antibodies, and they have corrected very well in our practices. Next, please. Again, TPO antibodies, iodine is hyaluronic acid. So it inhibits, again, why this is very important? Because it's a very key regulator for apoptosis and cellular proliferation in thyroid. It inhibits epidermal growth factors from thyroid follicles. Again, this is very, very key factor for apoptosis. So when we talk about apoptosis, the normal apoptosis, this is very important. Next, please. Again, iron transport problems, when problems dealing with iron use, think of detoxification, think of salt, think of water, liver and kidney support, exercise and clean diet. Next, please. So thyroid antibodies, oxidative damage to the thyroid. So we need to talk about oxidative damage. Again, Hashimoto's thyroiditis versus lymphocytic thyroiditis. This is a diagnosis which we can defer. Next, please. Again, mechanism, again, anti-TPO antibodies with the H2O2, high cytotoxic free calcium, can and elevated levels of H2O2. Only magnesium, iodine, vitamin C can reverse this mechanism. Again, iodine. You need to take the proper iodine with the under physician guidance only. Next, please. So, Lugol solution combines of iodine. We do give in the US, we do give some patients iodine. Again, the dose is very specific. Unfortunately, we don't have this testing in India, for me at least. I don't have this testing in India, so it's very, very difficult for us to know whether they are not, overdosing the medicine. So, if we have a lab that we can test that, then we can control that, and we can make the patients better with the thyroid, with the hypothyroidism. Next, please. So this is the test. Again, thyroid peroxidase antibodies, free T3, how it's different, where it is free T4, reverse T3. This is the testing which we did. Again, this is what our patients, one of the patients, so this is how the test will you get and how they are different in terms of TSS third generation. Next, please. Goitrogens, again, goitrogens has bromide, because again, methyl bromide, a common pesticide used in strawberries. Bromide vegetables oil, which is against citrus drinks, asthma inhalers, and fire-retardant fabrics, mattresses. So goitrogens can be the food additives and the pesticides, and what all can be. So bromides can be any kind of brominated vegetables which give them shine. So they look at where they're using and how they're using the pesticides, what we're using right now. So food additives gives us a lot for the growing. Next please. Again, gluten-free, aspartame, no trans fat, whole foods, magnesium, selenium, the holistic approach for the thyroid. Again, natural hormone, desiccated thyroid hormone to underlying infections. Again, underlying iron deficiency that replace under physician guidance. Next please. Start slow. Okay, check pre and post levels of iodine if you have access to. Get ultrasound before starting the treatment when indicated. Combine treatment with holistic plan, diet, minerals, and detox. So take your own time. Don't be in a hurry to get the TSH down, but take your own holistic approach for simple thyroid cases as well. Next, please. So this is a book that you can read about iodine. Okay, Dr. David Brownstein had much more insights into iodine and its role. Next, please. So autoimmune also can be related. So any kind of autoimmune problems can be addressed because in our regular medicine, in the mainstream medicine, we all say autoimmune disease is idiopathic. Because it's not idiopathic anymore. We have results for any kind of autoimmune problems because it could be environmental and immune regulation. Next, please. Again, bone marrow and thymus, as beautifully somebody, the previous speaker, they did an extraordinary study about thymus. So where we go wrong in our autoimmune and lymphatic and peripheral lymphatic organs, because we need to understand our bone marrow and thymus very well. If we don't understand our bone marrow and what's going on in the thymus very well, the mature B lymphocytes and mature T lymphocytes, they are equally responsible for autoimmune diseases. Next, please. So this is lymphocyte subside. So plasma cell cytotoxic lymphocytes and T helper lymphocytes. This is basically, I get into for simple thyroid problems, what kind of lymphocytes and what kind of thyroid, T lymphocytes versus B lymphocytes, the lymphoid precursor, how we can be different for every autoimmune disease. Next, please. So T1 to T2 lymphocytes, again, T1 is a subset of helper T cells that secrete particular set of cytokines, again, defense against infection, especially with intracellular microbes. T1 predominance results in Hashimoto's. So you need to understand what are the lymphocytes difference between T1 to Th2 lymphocytes. Next, please. So helper cells, again, antibody mediated helper cells. If you can understand immune mechanism much more in detail, we can have depth understanding of all autoimmune and they can be curable. Next, please.
Dr. Sudha